We're going to begin this hour with a startling look at maternal health in this country. Black women are about 3 times more likely to die from a pregnancy-related cause than white women. The maternal mortality rate for black women increased significantly from 2018 to 2020. The new documentary, Aftershock, follows the families of women who died from preventable causes related to pregnancy.
We keep showing up. We're not letting the pain stop us. We are holding people who have the most power accountable for how they use it.
Our maternal health community is really pushing for change on Capitol Hill, trying to bring about different legislation in order to make sure that women have the care that they're supposed to.
I can't let Amber be another statistic. I'm making people aware of what's going on in these systems.
I planned on spending a lifetime with Amber. I wanted to give her my life. This way, I'm still going to.
Oh, the husband stories are heartbreaking. Tonya Lewis-Lee is Aftershock's co-director and co-producer. Dr. Neel Shah is chief medical officer of Maven Clinic and assistant professor at Harvard Medical School. We welcome you both. Good to have you here. I want to set the table, guys, with statistics from the CDC so people have an understanding about what we're going to talk about. Black women, 3 to 4 times more likely to die than white women with the same symptoms. Over 60% of the deaths are preventable, and black women today are more likely to die of childhood complications than their parents, which means our daughters, Tonya, have a better chance of dying than we did. You know, I knew that this was a crisis. I had sort of heard about it, but when I saw this documentary, it made me so angry and so sad. I think Aftershocks is a very good title for it. Why is this happening, Tonya?
Well, it's happening because unfortunately, the healthcare system is built on a system of racism, and people don't want to listen to black women when they have complications and symptoms. Amber Rose Isaac, Shamani Gibson, 2 women whose families we follow in the film, they went looking for help. And they were dismissed when they were expressing their symptoms.
Well, they went to the hospital, Neel, and they were complaining about the symptoms: shortness of breath, I can't breathe, chest pains, and time after time. In one case, the medical staff on 3 different occasions says, is she on drugs? Does she do drugs? Why are black women not believed, do you think?
Tonya said that the healthcare system is built on racism. And one of the things that I like to remind myself and remind others of often is that a bad system will beat a good person every time. And, you know, bias is sort of built into the way doctors are trained.
Doctors are trained to be biased? What do you mean?
They're not. Well, you know, there's a really thin line between clinical intuition, which is celebrated, which is like looking at someone and knowing if they're sick or not, and what's effectively racism.
So you think it has to do with training?
I think it 100% has to do with training. Yeah.
Now, abortion isn't mentioned in this film, but the overturning of Roe v. Wade is the backdrop in which people are watching this. So when you think about the connection between abortion access, safe births, and also the overall maternal mortality crisis, how do you see that all almost laying together?
Yeah, I'm deeply concerned. I'm deeply concerned for black women. I'm deeply concerned about delay of care when black women have complications, that they may have delayed care. I'm deeply concerned about the criminalization of women when there are miscarriages. I'm deeply concerned that black women will be criminalized. I just think that we are in a situation where the autonomy of women's bodies is in conversation, and we are already in a crisis around maternal health, and the Dobbs decision just is going to exacerbate it. I believe there was a study that just came out that that maternal death is going to go up 21% given this decision, 33% for black women.
I don't think people realize this is a crisis, though, guys. There's a line in the doc that really made the hair stand up on my neck where it says, black women having a baby is like a black man in a traffic stop. What do you mean by that?
Well, I think you got to pay attention every step of the way. Again, when we as black people are in certain systems, whether it's the criminal justice system or the healthcare system, as Neel just talked about, there is a bias against brown and black people. And so you need to be paying attention to who is dealing with you and how they're perceiving you, and making sure that you advocate for yourself in the best way possible.
In other words, one wrong move and it could cost you your life.
Absolutely.
You know, Dr. Shah, one of the things that I found fascinating in the documentary is you talk about cesarean sections and how before 1970, less than 5% of women who were delivering had cesarean sections, C-sections, and it's risen by 30% in 2019, but the outcomes have remained the same. We're talking major surgery. And yet hospitals make more money if they perform C-sections and spend less time in the operating room with a patient. Break that down for our audience.
That's exactly right. So since the 1970s, C-section rates have gone up by 500%. It's designed to be a life-saving surgery, but the reason that we're here is that maternal mortality is going in the wrong direction. It's going up. And term infants are 0% better off on average over that time period. And there's a lot of conventional wisdom about what's driving C-section rates.
But they're only, it's higher for black women.
Yeah,
it is even higher for black women,
startling.
which I think is really revealing, right? It's not necessarily that people are demanding more C-sections. It's that people are investing less and supporting people in labor, which is why the film depicts an alternate way to support people.
But yet you all say that you want this film to be empowering, because I tell you, I choked up a couple of times when you see the women before they had their babies,
Yes,
so
that was
full of life and joy, yes, and what their husbands are dealing with.
Very excited to be mothers.
Very excited.
Right,
Yeah, they were so ready, Vlad. So I choked up, but then it made me so angry. But you say, Tonya, you want the takeaway to be empowering. How?
I do. First of all, I think
it is must see. It is
yes.
must see.
Well, first of all, I think it's really important that you feel for these families, and we needed to put a human face on the women who are dying. We read the statistics, but they're not numbers; they're people. So you have to understand who they are. But then, on the other hand, you know, we do show an amazing birth in the film by a woman who really decided. I mean, she thought she was going to do the regular thing, and then sort of made a decision to see what other options are out there for her. So I would say I want the film to be empowering because I want women to come away, and families, to understand there's choice in birthing. You can birth in many different ways. You don't necessarily have to do it at a hospital. And that there are things that we all can do to improve birthing outcomes. And it's really incumbent upon us to figure out what that is.
Well, you gave us a lot to think about. One woman in the film, Shamani Makiba Gibson, who's no longer with us, we will not forget you. I mean, it's very powerful and very well done. Bravo to you both.
Thank you.
The name of the documentary is called Aftershock. It's streaming now on Hulu, so you can actually see it today.